Now that we finished Unit 1, the overview of the sterile compounding areas, and we talked about the responsibilities, the roles, the work environment as a sterile compounding technician, we're going to go over Unit 2, which talks about the compounding sterile preparations. These are more in-depth chapters as to specific activities and components of a sterile compounding technician. Within this unit, the chapters have not only the background information with the concepts and the training, but also procedural labs. With each of the next 9 chapters with these procedural labs, there will also be process validations. The process validation checkoffs are located in Appendix D in the back of your textbook. And what it does is it verifies your competency and skill levels in what is appropriate for Chapter 797. So USP Chapter 797 is known as Pharmaceutical Compounding and Sterile Preparation. In 2004, the first official version of Chapter 797 was adopted, and it became enforceable in January 2005. So, as I've stated previously, in USP, or the United States Pharmacopoeia, whenever there are guidelines or chapters written, anything that is under 1,000 is deemed enforceable. Anything over 1,000 is considered to be general guidelines. However, in the absence of any laws, the general guidelines kind of become the law. So 797 came out, and of course revisions were made. Some of the logistics didn't quite function properly. We had to find out what would really work in the real world. So in 2008, there were revised standards that were released, and that became effective June 1st of 2008. So what that did was it required the changes in the environment, so that secondary engineering controls, or the SECs, which includes the anteroom and the clean room areas, and the non-porous surfaces, the air exchanges, as well as the control of the ISO environment, all became enforceable. And that includes the cleaning requirements as well. Now, requirement for all pharmacies that perform sterile compounding, they're required to follow USP 797. It's enforceable by state boards of pharmacy, Joint Commission, and the pharmacies may be inspected for that compliance. Soon, USP Chapter 800 will be enforceable. It was ratified in February of this year and goes into effect in July. So we will have more updates. USP Chapter 800 is specific to hazardous drugs. Now, USP 797 is about the sterile compounding preparations, so it's about the pharmacy, with the exception of the immediate use risk level component. It's really the pharmacy is the only one involved with 797. USP 800 is different because it's anyone who handles any kind of hazardous drugs. And hazardous drugs may include other drugs other than chemotherapy agents. So 800 includes your manufacturers, your wholesalers, your warehousers, the people who transport, the receiving component of how they come into the pharmacy, your pharmacy personnel, proper storage, your nursing, your patients even, and then also disposal. So there's a number of other entities involved in USP Chapter 800. So when we go into the procedural labs, we're going to talk about things like best practice. So this textbook is written with the best practice in line. Does that mean that it is the only way that these processes are completed? No. Some facilities may have some variances in them, but this is the best practice. Real world experience, these labs are written as to what is realistic and actually in practice. They are also compliant with current regulations and standards, and progress from the most basic concepts to more advanced procedures. So the first thing that we're going to talk about in Chapter 6 is preparing the person to prepare the IVs or the sterile compounding. So that includes garbing and hand washing and gloving. And then the next step would be to prepare your environment through proper cleaning, disinfecting of the hood, and then onto the most basic of the sterile compounding products, and moving to more complex, which at the end includes TPNs and chemotherapy. So please make sure that you review in your textbook the compounding area procedures, and even if you do this every day, just to reinforce until it becomes kind of a second nature type of thing. So this information is located in your textbook on page 162 and 163. So what is completed in the anteroom? Physical appearance and behavior. Assess. Review, make sure that you are meeting all the criteria before beginning the preparation for donning your PPE. You know, you can't have cosmetics, hairspray, nail polish, jewelry, perfume, artificial nails. You can't have food or drink. You can't chew gum, have lozenges, things like that in the anteroom. You're going to do your calculations and gather your supplies in the anteroom. Wipe them all down before we bring them into the clean room, and then we also do the garbing, hand washing, and gloving in the anteroom. Well, we may or may not do gloving in the anteroom. If you're using sterile gloves, then you would don the sterile gloves in the clean room. If you're using non-sterile gloves, you may don them in the anteroom. And that's one of those best practice components that I had stated. It's best practice to use sterile gloves, but in reality, many pharmacies don't pay the money. They're more expensive, and find that with proper garbing, fingertip tests come back that with proper disinfection, non-sterile gloves are sufficient. So clean room procedures, things that occur in the clean room or the IV room itself. Restrictions of working in the hood, cleaning your hands with sterile foamed IPA before you put on your gloves. Don't bring in things that could carry bacteria or contaminants. Cleaning your gloved hands frequently with the IPA foam. Don't touch your face, hair, eyeglasses, garbage container. You really have to be present, because a lot of that stuff just we don't think about when we do it. You don't want to talk, be careful of sneezing or coughing, and we don't want to whistle when we're in the clean room, because that would cause an aspiration of fluid. Compounding, the hood should be on for at least 30 minutes before we use it. Cleaning the hood, following standard protocols before making any compounded products, and also at specific intervals designated by the USP 797. Perform all of the manipulations at least 6 inches inside the outer edge, and usually at least 3 inches from the side of the hood. We've got to be careful about where we place things in the hood, that we don't obstruct the airflow. Obstructed airflow is called a zone of turbulence, and it's exponential. So if you place something, you want to think about the air around it being disturbed about 3 times the width of what you're placing in there. You want to avoid contamination of touching items. Most of the contamination within a compounding area is through touch contamination. So there's certain things that once we've cleaned or sanitized them, we need to make sure we don't touch. as well as our critical areas or blocking fresh air to those critical areas. We want to wipe things down with IPA swabs to sanitize them for those critical sites like injection ports. We never want to swab anything that comes pre-sterilized, and that includes all parts of the needle. Do the proper insertion into the equipment that we're using. We will learn how to properly insert a needle into a vial. When withdrawing the fluids, we're going to learn techniques including exchanging positive pressure, and then always verify your measurement, and then we use a pharmacist check to verify that as well. We don't want any air bubbles. We don't want to put any excess air into our products, but it also can give us a inaccurate amount of medication depending on the number of bubbles or the size of the bubbles. When we're doing this in practice, I'll show you that, there's some micro bubbles that are going to be okay. It's kind of like a static bubble. We're going to inject the fluid into the IV bag by directly putting it into the port and then send all the medication in. We don't really need to worry about the air pressure with that concept. Completion, we're going to inspect the bag for leaks, for any kind of incompatibility. So we're going to hold it up and see if we have any precipitates or any kind of contaminants in the bag, particulate matters. Anything glass, your needles, your syringes will go into the sharps container. Other garbage or trash such as swabs and paper wrappings, syringe wraps can go into a regular trash receptacle. And then the maintenance of the hood, which we'll talk about in Chapter 7, is things like making sure that you change your pre-filter every 30 days, arrange to have the HEPA filter certified every 6 months, whenever the cabinet is moved, or if we think that the filter itself has been damaged. We need to make sure that we keep records. If it's not documented, it didn't happen. So we're going to keep records of when it's cleaned, when the pre-filter is replaced, whenever your HEPA filter is recertified, as well as any daily, weekly, or monthly cleaning of the sterile compounding area. All right, so now it's time for some questions.